In this podcast episode, Dr. Joel Gator Warsh, a practicing pediatrician, sheds light on the complexities surrounding vaccine safety, research gaps, and the challenges parents face when making informed decisions about their children's health. Drawing from his clinical experience and his new book, Between a Shot and a Hard Place, Dr. Warsh explores a wide range of topics that are often overlooked or misunderstood in mainstream vaccine discussions. One of the most eye-opening points Dr. Warsh raises is the misconception about how vaccines are tested for safety. While many believe vaccines undergo placebo-controlled trials using inert substances like saline, the reality is more nuanced. In most vaccine studies, the so-called placebo is often another vaccine or a version of the vaccine without the active antigen. This means the control group is not receiving a truly inert substance, which complicates the interpretation of safety data. This distinction matters because comparing one vaccine to another that may also cause side effects can mask potential risks. For example, if both groups in a study experience similar adverse events, researchers might conclude there is no increased risk, but without a true inert placebo group, it's impossible to know if the vaccine itself is causing those effects. Dr. Warsh emphasizes that this is not an accusation of wrongdoing, but a critical gap in how vaccine safety has historically been evaluated. Dr. Warsh stresses the need for open, balanced conversations about vaccines that respect parental concerns and promote informed consent. He is neither pro-vaccine nor anti-vaccine, but advocates for parents having access to comprehensive information so they can make the best decisions for their families. In his practice, he encounters a spectrum of choices, from families following the standard CDC schedule to those opting for slower schedules or declining certain vaccines altogether. He highlights the frustration many parents feel when their questions are dismissed or when they face pressure to comply with rigid schedules. The current climate often polarizes the vaccine debate, leaving little room for nuance. Dr. Warsh calls for a middle ground where medical professionals listen to parents' experiences and concerns without judgment, fostering trust and collaboration rather than conflict. A significant area of concern for many parents revolves around vaccine ingredients, particularly adjuvants like aluminum. Dr. Warsh explains that adjuvants are added to some vaccines to enhance the immune response, especially when the vaccine contains only parts of a pathogen rather than a live or killed whole organism. Aluminum is the most common adjuvant used, and while conventional research maintains that the amounts are small and safe, some parents worry about cumulative exposure. He draws parallels to past concerns about metals like lead and mercury, noting that mercury was once removed from many vaccines out of caution despite a lack of definitive proof of harm. The conversation about aluminum is similar, with safety limits existing for aluminum in water and air, but not necessarily in vaccines. Dr. Warsh advocates for acknowledging these concerns as reasonable and encourages further research to ensure safety rather than dismissing them outright. One of the most critical gaps Dr. Warsh identifies is the absence of robust long-term safety studies for vaccines. Most vaccine research focuses on short-term outcomes before licensure, with limited follow-up to detect potential delayed adverse effects. Current surveillance systems, like the Vaccine Adverse Event Reporting System, VAERS, rely heavily on self-reporting and require a clear link between vaccination and subsequent health issues, which is often difficult to establish. This lack of long-term data is particularly concerning given the rise in chronic diseases such as asthma, allergies, autoimmune conditions, and neurodevelopmental disorders. Dr. Warsh points out that while mainstream science generally denies a connection between vaccines and these conditions, the existing research is insufficient to conclusively rule out any association. He calls for more comprehensive, prospective studies to better understand potential long-term impacts. Dr. Warsh discusses the ethical complexities involved in conducting placebo-controlled trials for vaccines already on the market. The prevailing argument is that withholding a vaccine from a control group is unethical if the vaccine is considered standard care, especially for diseases like measles. Therefore, new vaccines are often tested against existing vaccines rather than inert placebos. However, this practice perpetuates the initial problem. Many vaccines were never tested against true placebos in the first place. This makes it difficult to assess their safety fully. Dr. Warsh acknowledges that while it may be nearly impossible to conduct such trials for established vaccines now, there is no ethical barrier to requiring rigorous placebo-controlled trials for entirely new vaccines entering the market. The COVID-19 pandemic dramatically shifted public awareness and attitudes toward vaccines. Dr. Warsh notes that before the pandemic, vaccine discussions were often muted or censored, but COVID-19 brought vaccines into the spotlight like never before. The rapid development, emergency use authorizations, and evolving messaging about vaccine effectiveness and safety led to widespread confusion and skepticism. Many people witnessed firsthand that vaccines did not fully prevent infection or transmission, contrary to early claims. This real-time experience, combined with changing guidelines and lack of transparency about raw data, eroded trust. Dr. Warsh believes this has opened the door for more honest conversations about vaccines in general, highlighting the need for transparency and humility in public health messaging. The vaccine debate has become highly politicized, with attitudes often aligning with political affiliations and media consumption patterns. Dr. Warsh observes that vaccine skepticism was once more common among highly educated, affluent communities, but has since spread across various demographics. The involvement of political figures and the pharmaceutical industry's influence on media and medical institutions have further complicated the conversation. He points out that this politicization has created a religion around vaccines where questioning is equated with opposition and dissenting voices are marginalized. Dr. Warsh advocates for depoliticizing the discussion and fostering an environment where diverse viewpoints can be expressed and evaluated based on evidence rather than ideology. Another important topic Dr. Warsh addresses is the waning immunity of many vaccines over time. He explains that most adults, especially those over 50, may no longer have effective immunity against diseases they were vaccinated for as children. This is due to the natural decline of antibody levels and the introduction of many new vaccines since their childhood. This reality challenges the notion that vaccination status is a lifelong guarantee of protection. Dr. Warsh suggests that many adults are effectively unvaccinated for several diseases and may need boosters or updated vaccines. Recognizing this nuance can help reduce the dogmatic stance some people take and encourage more personalized approaches to vaccination. Dr. Warsh delves into the contentious topic of autism and its alleged links to vaccines. He acknowledges that autism is a complex neurodevelopmental condition with multiple genetic and environmental factors. Importantly, he has cared for children with autism who were never vaccinated, underscoring that vaccines are not the sole cause. He critiques the common narrative that vaccine autism research has definitively debunked any connection, pointing out that most studies focus narrowly on the MMR vaccine and thimerosal, ignoring the broader vaccine schedule. Dr. Warsh calls for more comprehensive research that considers cumulative vaccine exposure and individual susceptibilities, such as mitochondrial dysfunction, which may predispose some children to adverse reactions. In his practice, Dr. Warsh frequently encounters parents who feel unheard or dismissed when raising vaccine concerns. He shares stories of families who experienced possible vaccine reactions but were pressured to continue the standard schedule or were even turned away from other medical offices for hesitancy. This lack of empathy and flexibility can alienate parents and erode trust in healthcare providers. Dr. Warsh advocates for a more compassionate approach that acknowledges parental fears and experiences, allowing for individualized vaccine plans and open dialogue. He believes this is essential for rebuilding confidence and ensuring children receive appropriate care. Looking ahead, Dr. Warsh is cautiously optimistic about the potential for change in vaccine research and policy. He highlights recent efforts by figures like Robert F. Kennedy Jr. to establish new vaccine safety commissions and bring diverse perspectives into regulatory bodies. While acknowledging the challenges and controversies, he sees these developments as opportunities to improve transparency, fund long-term studies, and refine vaccine schedules. Dr. Warsh envisions a future where vaccines are safer, better studied, and tailored to individual needs. He stresses that this requires humility from the medical establishment, willingness to listen to parents, and a commitment to ongoing research. Ultimately, his goal is to foster a healthcare environment where the health and well-being of children are paramount, and vaccine decisions are made with full information and mutual respect.